Hello everyone, welcome to tonight's live Q&A. We're going to be joined very shortly by Trang, my partner in crime. We're going to talk through, today we're going to go through some of, or I guess a bit of a reflection and some of the things that we covered on the weekend in our running workshop. And I'm going to add her in now actually, so if you can add in here, Trang, there you are, there, and if you were joining in already, here we go, and I'm gonna add in here, there we go. Now, but we're going to run through, so we'll run through a bit of Q&A on the questions we had from the weekend. We've also got a few questions. Hey, Trang.
Hello.
Yes, I was just saying what we're going to cover through today. So we're going to go through a bit of a reflection on the weekend, and then some of the questions that we got asked on the weekend, and then some of the questions that we've had in the last 24 hours, and of course any live questions as well that people want to throw at us as we go through. So first on the weekend, it was a good fun weekend, wasn't it? We had beautiful weather in Melbourne, which was great. And a good group of participants as well.
Yeah, it was so good to have like our second booked out workshop, and with a good group of people. As you mentioned, Melbourne turned up the weather for the weekends. We were looking at the weather leading into the day because we knew we wanted to do a lot of the practical outside to actually do the running drills and look at people's technique and stuff, which we were able to do. So super practical, but a lot of information as well.
Yeah, that's right. We had the backup plan. We're lucky we've got a bit of space inside the clinic that we were going to do some of the running drills. If it came to it, we were going to have to do them back and forth. It's going to be cosy, and Melbourne being Melbourne, you never know what you're going to get. So when we planned this a while ago, we thought, well, look, we'll see how we go. And funny enough, actually, I've had a pretty good run because I've done these sort of running workshops for quite a few years now, for probably 5 or 6 years, and I've only had one day that rained, and it was a little bit of a sprinkling, so we've kept that run intact. So people have asked, we're going to run another one, and we probably will look to do another one later in the year, as well as the strength and conditioning workshop as well. So you can all stay tuned for that. But thought we'd kick off with some of the things the questions that were asked and from the weekend, and some of the things that we covered. I mean, basically what we did go through on the weekend was some of the fundamentals to running technique, and then we went through some drills as well to sort of practice and refine those. So one of the things that one of the big things that a lot of people would have heard about was cadence, and cadence was something we spoke about there, and we put up a big image of a 180 with a cross through it, and that's because there is no magic number for cadence. So 180 is not the magic number. It's something that sort of has been going around for quite a while, and in a number of circles, and we know that that's actually, instead of a magic number, we tend to see a preferred range. But everyone is different shapes and sizes, different strengths. We've got different length legs. You're not going to see everyone running at the exact same cadence. And like what we saw in the group there, we got everyone to look at their watches and check their cadence from their runs. And we saw some people in the 160s, and there was even one runner in the high 190s actually. And she was even said she hit 200 in one of her, I think, her run that morning. So big range that we tend to see. Why we sort of see a range is that it's if we can sort of see things like overstride is probably one of the big things that we want to try and avoid. And what overstride is that landing a long way in front of that center of mass, and basically what that's doing then is it's creating a lot of braking forces. So it's sort of a lot of impact to deal with there. Napier in his research found that overstriding was related to injury in his female cohort, and there've been a few other studies as well linking that. So it's sort of more. If you can have a cadence of in the high 160s, and you're landing in a relatively good position, then that's okay. So that's where we don't sort of say yes, you need to be at this point there. We generally tend to find though that those are in sort of like a cadence of 150 or low 160s. generally are overstriding, we do see those things match up there. So it's relatively uncommon to see that that's low cadence and also not possessing an overstride. So that was something that I think, you know, the participants had sort of, you know, they had heard that 180 number, and some were sort of, you know, aspiring to that. But that's something that we sort of a bit of a myth that we busted there on the weekend. Anything to add for that with the cadence?
Yeah, I think you explained that pretty well. Something else that I usually use to explain to people to be able to visualize this range is like thinking of cadence like a bell curve. So you might have 180 right in the middle if that's what you want to use, but then there's an acceptable range either side of it. And if you fall within that range, there, like you say, there might not be any indication to like isolate the cadence and change it, because it might not actually make any difference to performance. It might not make any difference to injury risk. But it's more if you're like on the extreme ends of the bell curve, which there are less numbers of people in the extreme ends than the numbers who would naturally fall in that in the acceptable range. Then there's more of an indication, more of a significant effect if you do make just like a small 5% or 10% change in cadence.
Yeah, and cadence is, look, cadence can be manipulating cadence or changing cadence, and you know, we used a couple of slides to demonstrate some of the changes that can be created by changing cadence. Things like influencing overstride we mentioned before, but also in terms of impact forces and shifting load, you know, from away from the knee with those increase, but that does come down to increased forces through the foot and the calf there, and cadence it is something that we will use, because the good thing about changing cadence is that you don't have to be so descriptive with what you need, the changes that you need to happen. You just simply tell the person, you know, run to this cadence, and they can find their own strategy to achieve that. So it can be a little bit more, it's not as taxing economy wise. It also is easier for them to learn, because you're not, you know, we really try and stay away from, if we're changing running gait, we're trying to stay away from, you know, tighten this or pull this or contract this muscle. We're trying to use what we call external cues that can help you know, beginners, and when you're trying to relearn or learn a skill, it's easier to do that. So that's why cadence is used. It's not the be all and end all, and doesn't solve everything. And there, you know, we could see, you know, if we see someone with overstriding, there's a number of different cues that can be used to change that. But cadence and increasing that is can be a useful way, one of the ways. And in terms of how much, well, really, you know, like we spoke about on the weekend, you want to change as little as you can to create the biggest change. So really, you've got to be very careful with creating big changes in running technique, because that will shift forces, and you know, you are going to be putting load on different areas, and you don't want to be you know, overloading something and causing a problem. So you know, starting off, you might increase your cadence by 5%, as little as 5%, and you know, increasing a little bit more than that. But generally, I don't go any more than sort of 7.5% you know, increasing cadence, and that might not seem like a lot if you're doing it, you know, at 160. I mean, 5% there is only 168. So you know, you're not going up a bit, but you know, when you are doing that, people will feel the difference, and it will feel a little bit harder when they're doing that. And that's something also we sort of we touched on as well, is talking about the effects of running economy that can have when you are changing your running technique. There's been a few studies that have shown that your running economy can initially take a bit of a dint when you change your technique, and that sort of makes sense. And when you think about it, you know, if you're trying to change anything, like you're trying to change a golf swing, you know, you're going to be thinking about things. It's not going to be a fluid movement, and so therefore you can suffer a bit in the running economy. And that's where the other thing, when we're changing these things in clinic, is, you know, we're asking how easy does that feel, how hard does that feel, and if someone's really struggling with it, it's like, oh, this feels really, you know, really tough, and all of a sudden their effort's gone from like a, you know, RPE of 3 to all of a sudden a 7, and they're still at that same speed. Well, that's probably not a great, you know, cue for them to do. So it wants to be, you know, we want to create a change, but we don't want to make it too difficult on their running economy. But looking at what the research shows as well, is that initially there may be a dent in running economy, but then down the track that running economy drops back down to where it was. And some studies that have looked at that, there's one study that was even as early as 2 weeks, and others at sort of 6 and 8 weeks have shown that running economy then goes back after initial bit of a dent. So there are a few things with sort of, changing cadence. If firstly, that 180 is not the magic number. The influence that cadence can have by changing that, and then also touching on changing and running economy.
Yeah, for sure. Well, we'll keep moving through the questions that were asked on the weekends. And for anyone who's watching live as well, like, feel free to ask any questions that you might have, whether they're like fresh questions or questions based off what like Luke and I have been talking about as well. That's the benefit of being live. You can get interactive. Another question that was asked on the weekend that I think is quite commonly asked is how to reduce overstride, because that's probably one of the most like well-known running technique faults that people hear about. Like you mentioned, a low cadence is going to be more associated with overstriding. So what are some cues that people can use to actually reduce their overstride?
Yeah, so there's a few things that can be used for that. And Sophie, I saw you've asked a question too regarding that. That cadence. We'll answer that straight after this. But cadence is one way to do it. The other thing is focusing on recovery even as well. I mean, if the other thing that we may see and often see in those that overstride is that they can have a real up and down bouncy movement, or what we call increased vertical oscillation. So they're the really guys who tend to be the main culprits there. So they tend to be really a lot of up and down. So you can tell, sometimes you can tell them actually just to being quiet. So can reduce that vertical oscillation. So a slightly different cue there. You can cue them to focus on their recovery. So whether that's pulling the leg through, or actually planting it down, actually just getting them to think about landing closer to themselves, so not landing so far out in front of them. And we want to watch with that, though, that once you start to bring people's attention to that, then their head starts to sort of drift down and see where they're looking, and that sort of ruins our nice upright posture there. So we always want to watch that, what the eyes are doing, and sometimes if people aren't used to running on treadmills, that's where they'll look down. But yeah, look, a lot of things that can be used. You can use your audio, auditory cues of just listening to what you're doing and how hard you're landing there, cueing softer landings. You can get them to think about their body parts as a little bit more of an internal cue, if they can follow along those lines. Otherwise, cadence is another sort of auditory cue there we can do there as well.
Yeah, cool.
Now, we've had a question actually from Sophie is asked. She said that I find my cadence is significantly lower on the treadmill, 160 compared to 180 outside. Would you say that I'm likely overstriding on the treadmill? It's an interesting one actually, because usually we find that it's the opposite. So usually people's stride length is actually shorter on the treadmill, and the research has shown this as well. That step length is usually shorter and cadence can be fractionally higher. So you can find that, and so when we're seeing someone, assessing someone on the treadmill, and we are seeing them overstriding, then you can probably you can extrapolate that they're probably doing that outside too. So it's interesting, Sophie, you find the other way. I mean, why that could be the case. It could be just, that you're not so used to running on treadmills. We actually wrote a blog a few months back about looking at the difference between, running outside and running on the treadmill. And there's been a number of studies that have looked at that, and Bas van Huren has done one. But collectively, there isn't a difference as a group with position mechanics and kinetics, so sort of forces, but there's always individual differences. So someone, as a group, so the average of the group was that there's not a big difference, because one of the things that you hear is running on the treadmill, it makes your calves lazy, or it makes your glutes lazy, because you're not, you've got the belt moving underneath you, but what the research shows is generally that's not the case. but there are always individual differences, Sophie, and you're obviously one of those. As I said, whether it's one that you're just not feeling very, very comfortable on the treadmill, whether you are, you're just on the treadmill, you're just, maybe you are bouncing up and down more on the treadmill, and so rather than focusing on that forward propulsion, that horizontal propulsion there, so maybe you're just sort of essentially jumping up and down and having that band moving underneath you, and so that way you could be having greater vertical oscillation, and therefore your cadence dropping right down too. So and that's the value sometimes of also seeing, the beauty of having the the Garmin's is that it can capture a lot of and the smartwatches capture a lot of data these days, that we can compare what we're seeing on the treadmill to, all right, let's see what your watch is showing us, and increasingly we're seeing with the use of wearables and some of the stuff that can collect, it's really useful actually now that we can what we can use.
Cool. Awesome. One more question actually that came from the weekends that I think is going to be really practical for the runners who are watching is how to actually implement these running technique changes effectively. Like should runners be like constantly thinking about that for the entire run, or do they implement it over a few weeks? What was your recommendation that you shared over the weekends?
Yeah, and I remember actually having a runner years ago, and she'd done some reading on running technique, and so was implementing that, and she's like, I'm just I just hate running now because I'm constantly thinking of it all the time, and she was she normally her running time was her time to clear the head, as it is for a lot of us, and myself included there. So I sort of said to her, well, no, that's not the case. We don't want you doing that, and the reason why we also don't want to do that too is because it doesn't help you learn the movement. If you're constantly having to think about it, or constantly needing the cues to like turning on the metronome for your cadence, then the movement and the things you're trying to do don't become internal, they don't internalize. And so the researchers looked at that, and they've, Rich Riley and Irene Davis's group have done a lot in this, and doing what's called a faded feedback protocol. Now in the research and in the lab, what they'll do is they'll usually do 8 sessions over 2 weeks, so usually 4 sessions a week. What they do is they gradually build up the running time that they have these people on the treadmill for, and what they do is they actually so say for instance cadence, we want to increase your cadence, so we'd have the cadence going pretty much continuously all the time, and then each session sort of they gradually take that away, so it's sort of less and less and less. And so one of the things that one of the little sort of strategies that I tend to use is that in the first week that you're trying to create these changes, every kilometre that ticks over on your watch is just a reminder to do something. So whether that's just got to remember to not cross my arms in front of me, or maybe I need to change that cadence, so I just need to switch my metronome on just quickly and listen to that, get the beat of that, turn it off, then the next K, then do it again, and so then from that week, then you go on to then in the second week, and you can do every second kilometre. So instead of the first week is every kilometre, then it's the second kilometre. Then in the third week, what you can do is you can just check on every alternate run, and then in the fourth week, then you can just do it as you really feel like it. So the idea is, again, not to be thinking about it all the time, but it's just sort of as that little reminder, and we're gradually taking that away. Now, if you're finding that, oh look, I'm struggling to internalise that movement and get that going, then you can just you can repeat a week. So if you refine on a week, I'm not quite ready for week 2, then you can just keep repeating week 1. So I've used that quite a bit with good success, and helping to create those changes. So that faded feedback protocol.
Yeah, it's really good tips, because like you said, you don't want to be the person listening to a metronome for a 30-minute run.
That's exactly right, and that's where, as I said, that constant beeping is would drive you mad. So, and you'd be hearing beeping noises all day if you're doing that. So yeah, definitely don't want to be doing that. So, and we can post that link as well with the faded feedback protocol for everyone as well.
Cool, that's really good.
Yes.
Yes. All right, so we did get another question actually that was more around strength training. So what are the non-negotiable strength exercises to prevent injury? And so this is one that we actually covered in the strength and conditioning workshop for runners back in March. we covered this in detail, and then we actually did the demonstrations and practical session for each of these categories. But essentially what we covered in the workshop was less around specific exercises that were non-negotiable and more around movement patterns that were non-negotiable. And the reason for that is because exercises are really specific, and you can interchange different exercises and they're both going to be like just as good as each other for the runner. So taking a step back and actually looking at categories of movements or categories of muscle groups is actually what's going to be more relevant, because then you can hit all the important categories and then interchange exercises within those categories. So within the strength and conditioning workshop, what we covered was the Big 10 for runners. And we did do a reel on this as well. So make sure you go check out the reel. We covered what those Big 10 were, but pretty much the Big 10 is a split into 3 main categories. So the big rocks. Oh, I'm frozen. You're not. So
no, I'm still going. I can hear you. Just can't see you. But you at least could have smiled when you were freezing up there. So
yeah,
I can still hear you. So carry on.
I'm gonna keep talking and just hope that Instagram chooses to unfreeze me.
That's right.
My internet looks pretty strong, so I don't know what's going on.
Yeah.
So the 4 big rocks, which are the main movement patterns. And then we've got the 3 accessory rocks, which are also important, but only once the 4 big rocks are in place. And then the 3 small rocks. So the big non-negotiable big rocks are the squat movement patterns, the hinge movement pattern, heel raise, because we know calves, Luke, that's right down your alley.
Yep.
Calves are a big one for runners, and plyometrics as well. So you want to be doing variations of those 4 movement patterns over the course of a week. And then the next, you've got the 3 accessory rocks. So that's the split stance. I'm still frozen. I love this. Split stance. So single leg exercises, because when you're running, you're only on one leg at a time. You want to get both legs strong, independent of each other. The knee curl to work the hamstring, and the core as well, because we know the core does a lot to transfer forces between the upper and lower body. That's where kind of a lot of the force comes from. And the small rocks, the extras that are also good to do, but once again, only once the others are in place. So hip flexion movements, foot strength, the ones that we all know we should be doing, but we kind of neglect, and upper body as well. Because even though you're not using your upper body to run, our body works as one big coordinated unit. So we want to work the whole body as one, as movement patterns, rather than just the lower body and neglecting the upper body. Oh, I'm back.
That's it. You're back. I still can't see you. You're still frozen on mine. So, but yeah, I think it was a reel we did early last week. So I think that's that people can look that up as well too, and for the list of the Big 10. The couple more questions we've got, and obviously if there's any more that people want to ask, then continue to fire away. When's it okay to run through pain versus not run through pain? And we've had a couple of reels on that, which had a bit of a laugh about, and had a good time making. Actually, it was good fun. When to not run through pain? Well, we'll run through pain first. So that was in our first reel. So generally, we try and keep runners, and this is inclusive of all sports as well, try and keep people training and competing if we can, if it's safe to do so. And generally that comes at a pain level, and we say sort of a safe pain level of 4 or 5 out of 10. And that's 4 or 5 whilst doing the activity, and also then afterwards. So we're not seeing you do the activity at a 4 or 5 and all of a sudden my knee's blown up to a 10 out of 10 that night and the next morning. So we like to sort of see that pain remain nice and stable. So that's one of the first things there. The other thing that we want to see too is that it's not affecting your the way that you move, or what we call your gait. So if you've got a sore ankle and it's like, well, it's not really hurting you, but then when we see you run, you're really sort of favouring one side, then that's not, we don't want to see that either. So that's sort of when we sort of shift and try and say, all right, well look, we need to modify something here. So we might need to have a little bit of a break, or just at least reduce a bit of of your your mileage, a bit of your volume, work out how to come back. Then with some of the things that we when we say, look, it's probably a good idea that we have a bit of a rest. Firstly, if there's a suspicion of a bony stress fracture, and I think Treng's coming back, joining us now again, and wait for her to come back in, and waiting. I think I can hear you. I can't see you yet though. You're back?
Kind of. I'm frozen again.
Oh, it's not giving us any love, is it? But well, we can hear at least anyway. So, whether it'll come back up, but there we are. I got you there. You there? There we go. All right. So if we're sort of suspecting a bony stress fracture, now that stress fractures not all need to be complete cessation of running and training. So some can be run through, but it depends on the stress fracture. It also depends on sort of the stage of competition and where you're at. And so there's a few things that go into that, and that's not a decision that you want to make on your own. You need to have a health practitioner that will run through and that's used to dealing with runners to guide you through that particular scenario. But basically, yeah, the escalation of pain, if it's continuing to increase, then it's time that that we may have to back off, and that doesn't always mean completely stopping. It just means that we may just need to reduce some intensity or reduce some volume, depending on what the injury is and where you're at in particular part of training. So, but yeah, if you want to learn more about that, then have a look at our last couple of reels on that and have a laugh at our acting skills in the meantime. So the next one here we've got is recovery time for Achilles tendinopathy. So this is a good question, and in short, it's that they don't tend to be quick injuries to achieve full function with. They do tend to take time, and time we're talking months, and that can be upwards of 3 to 6 months to get full function back. Now, what that doesn't mean is oh great, that's 3 to 6 months of no running. Not at all. It means that and if we can keep the pain at a stable level, like we were just talking about, then we continue running. And most of the time, most tendinopathy can continue to run to some extent, whether that's even doing all your mileage, but we just make sure that we work on other things and work on strength and some of the rehab to keep that pain under control. So it tends to take a time. There's a number of studies, and Silvernacle, Seth O'Neill, a few studies that they've done as well have shown that years down the track, people that have suffered Achilles tendinopathy still have persistent functional deficits. So they still have strength loss in that in that side. They still have loss of hopping ability, or what we call that plyometric ability there. And so it's really important that you rehabilitate them properly. So you don't just sort of think, oh yeah, I'm back running, it's fixed. Well, it's not, because this research has shown that just because you're getting back to running does not mean that you're getting back to full function. And that's really what we aim to do, is not just get people back to running and have you limping and hobbling around, but also make sure that we're achieving that full function. And some of the ways that we do that is through our testing equipment that we've got. So through our Axit system, we've got the ability to test people's strength. We've got the ability to see how they're hopping and jumping and measure that. And so we find that that's particularly useful for tracking that progression of improvement and making sure that you hit that full functional recovery.
Yeah, that's a good point. I think like the fact that you mentioned that it's not a quick fix, that's one to remember, because and it's totally understandable. We all want to get back to running as soon as possible if we do need to stop in the first place. But it's more like, a lot of people want to get back to unrestricted running as soon as possible. But then also, if you do the rehab properly, you take your time, then you will get back to unrestricted running as soon as possible, and then stay with unrestricted running for as long as possible as well.
That's exactly it. It's not just making a one-time comeback. It's making sure that it stays good, definitely. So. Now I've got one last question. If there's any others, then please jump in. This one's probably for you, Trank. How to do strength exercises for the knee when a knee pain's stopping you from going down into sort of deep flexion. So it hurts to go down there. What are some tips there for managing that, Trank?
Yeah, that's a good question. And it's one that does get asked because it's kind of like you want to do knee exercises to get the knee stronger, but then the pain is stopping you from doing knee exercises. So it's like, I'm stuck. What do I do? Um, the good thing with exercising the structures around the knee is there are other modifications that you can start with. So you can start with exercises that don't require any knee flexion. And yes, they might be more glute exercises, but you can start with those and get the ball rolling if the pain is stopping you from going into any knee flexion. So you can start with glute exercises that you can have your knees straight. So things like crab walks, where it's just like a soft knee, or even banded hip abductions, or the hip abduction variations, working the glute med is a good one to start with because you're not having to flex the knee at all. And then you can start to move into more hip dominant exercises with small amounts of knee flexion. So exercises like hip bridges or hip thrusts, hinge movements, one of the big rocks of the Big Ten. So doing deadlifts, you're going to have some knee flexion, but the movement is, and the force is like predominantly around the hip structures. So you can start with that. You might even be able to do squats, but not to full range. That's still going to do something if you start with like half range squats, for example. And then as the knee structure gets stronger, as the pain starts to reduce, you can then start to go into deeper amounts of flexion. And how much flexion you need is also like something that's worth considering, because as runners, if your goal is primarily to strengthen to run, you might not need to even go ass to grass squats because you're not a power lifter, which is good, because then you don't necessarily need to go as low, and you don't necessarily need to aggravate your knee. I know in the gym culture, it's like, ask the grass squats, like you're not doing that, your squats don't count. But for runners, you don't even need to do squats all the way down. You don't even need to do deadlifts from the floor. You might even want to do like deadlifts from halfway. So rack pulls is what they're called, and that doesn't require much knee flexion at all. So yeah, kind of just like building up step-by-step approach, and then taking it as it comes is the way to go.
Excellent. That's some good tips out there. So for those that are having suffering knee pain, and knee pain being one of the biggest running injuries, and what's called runner's knee. So good tips for those that are working in the gym as well. The last one to finish up, actually, we're going to had written down here something that we both get asked quite often. Actually, is around telehealth consultations, and it's certainly something that we find in the last 12 to 18 months with COVID, not necessarily by choice, but forced to do that, and but actually found, and me personally found it obviously doing increasingly more last year, but now using it as quite a useful tool, still ongoing, even though we can do, we're unrestricted with our face-to-face consultation. So I guess, did you want to open up in terms of some of the things that can that we can offer from a telehealth versus face-to-face, or the differences there?
Yeah, I find telehealth so beneficial with a lot of clients who are interstate or overseas, first of all. So then that's a great way to cross that barrier. But also, like, because we both have a strong emphasis on rehab and treating the root cause of an injury. So it's like, yes, you don't get to do the manual therapy at all over a camera, over telehealth, but then often treating the root cause is about doing some exercises, is about education. So I guess, teaching the patient what to do, adjusting the training program so that they're not going too hard too soon. All those things can easily be done over telehealth, can be done over a Zoom call. And they're the ones that arguably like make the biggest difference. They're the ones that is like 80%, of treating an injury. And then say if someone wants manual therapy or like a massage or dry needling or whatever it is, manipulations, or if they want like a diagnosis that may require in-person testing, then I would usually then recommend them to see like a local health pro that's in their area. So that's kind of my approach. So they're really good. Telehealth I find really good follow-ups, especially because then, you know, people don't, it just is like more convenient as well. But what about you, Luke? What's been your experience in doing telehealth?
The same with you. It's been quite good. I mean, I have got a number of patients that will travel, you know, and I may see them on the initial consultation. And what that allows me to do is it allows us to perform a lot of the testing. So, you know, because we do have that access system there, so we can do a lot of stuff face to face initially on that first consultation, and then, you know, then obviously them being then a distance away, we can do a lot of the follow up and the progression of their rehab by that. As you said, if we're needing any sort of hands-on work, then I'll often work in conjunction with someone local in that area that can provide those things. But yeah, it's obviously then saving that person having to make the travel there, if we're able to progress a lot of those things. So yeah, I found it really useful, and certainly find myself still doing a number of those, and some, you know, as you said, people overseas that I haven't even seen face to face. So and we do have, you know, there's a number of tests that we can get them doing. Obviously they can't have access to our access system, but there's a lot of tests that we can do, even strength tests and performance things in movement tests that we can have them doing, and watching them when they're doing it on camera. So yeah, lots of things that can still be gained out of it as well. And you know, it's especially for those that have you know, might not have someone in their area that specialises in runners or is used to dealing with that sort of population. It's been quite useful for that.
And some of those like those functional movement tests that the patient can do themselves are some of the most relevant ones, because it's like the movements that they do in day-to-day life. It's like what replicates their symptoms. So they're the ones worth testing.
Yeah, absolutely. So yes, for anyone that might have been on today or watching this, and you know, you are living away, you can't get to the clinic, that's certainly something that we do offer. So, but I think that's all the questions. We've had some good questions there, and thank you everyone for tuning in. And if anyone needs any help, then don't hesitate to reach out to us and hit us up. Otherwise, enjoy the rest of your evening, everyone, and we'll see you on next time.
Bye.
Thanks, Frank. See you later. Bye.